To perform the group manual muscle test for hip adduction, adduction, the patient is positioned lying on their side on the mat, and for hip adduction, we're testing the lower leg, the leg that's on the mat. The upper leg, the non-tested lower extremity, is positioned up this way, and you simply hold that up out of the way into abduction, and then instruct the patient to adduct the lower leg, bring that one up. And then your location of resistance is the medial distal femur of the tested leg. Your position of stabilization is the distal medial femur of the upper leg, and you simply push the lower leg straight on down. Hold, 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 hold. Very good. Relax. In this test, basically what you're doing is just pitting one set of hip adductors against the other set of hip adductors. So if the patient strength breaks less than a 5 out of 5, you have to then determine which set of hip adductors lost. And the way you determine that is by observing the pelvis to see, was it the lower leg that gave loose, in which case the pelvis would stay in the same place, or was it the upper leg that gave loose, in which case the pelvis would tilt. Also, this is going to require some trunk stability from your patient. There is an alternative way to do this test that is a little more straightforward in terms of determining what it was that gave loose. And in the alternative version, the upper leg, the non-tested leg, is simply brought up and onto the mat. The foot is brought onto the mat, thus stabilizing that upper leg. When it's done this way, your location of stabilization is the iliac crest of the non-tested side. Your location of resistance is still the distal medial femur of the tested side. So can you bring this leg up off the mat, please? Thank you. Give resistance. Hold, 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 and relax. And in that test, then you eliminate what's virtually a tug of war between the two sets of hip adductors.